I'm Kristen. I'll be the nurse conducting your physical exam today. I'm just going to be starting at your head, working my way down to your feet. But first, I'm just going to go ahead and wash my hands, put my gloves on, and provide you with some privacy, okay? So I'm verbalizing washing my hands, putting my gloves on, pulling your privacy curtain. All right, and I'm just going to start off with some questions about your health history. So can you tell me your name and date of birth?
Dawn Odom, 5/16/71.
Okay. And can you tell me what the year is?
2021.
Can you tell me where you're at right now?
I'm at the doctor's office.
Perfect. Can you tell me what you're here for?
Just my routine exam.
Okay, good. And what brings you in today?
Just a regular checkup.
Okay. When was your last checkup?
It's been about a year ago.
Okay, good. And can you tell me a little bit about your personal and social history?
I'm married. My husband, we've been married for 27 years, and I'm a school teacher.
Okay. And what medical conditions do you currently have?
I do have sleep apnea. I have a CPAP that I sleep with at night, and I do have beginning stages of arthritis.
Okay. Do you take anything for the arthritis?
I do have some 800 milligram Motrin that I take when it's necessary.
Okay. And what surgeries have you had in the past?
I've had a tube ligation, had my tubes tied. I had my uterus cauterized, an ablation. I have had a bladder tack. I also had a repaired meniscus in my left knee, and they cleaned out the arthritis.
Okay, good. Do you have any allergies that you know of?
No.
Okay. Tell me a little bit about your family history, starting with your mom, dad, and then any siblings you may have.
My mom is still alive, and she was diagnosed with leukemia 22 years ago. She has gone through one stage of chemo. They have been watching it lately because it's gone back up. She had a stroke about a year and a half ago. My dad passed away, and he had lung cancer.
Okay. What about any siblings?
I have a brother that is perfectly healthy, older brother.
And how many children do you have?
I have 3 daughters.
And how did you deliver them? Vaginally, C-section?
All vaginal.
Okay. What immunizations have you had?
Most recently, I had the whooping cough. I did have my flu vaccine, and I'm on the waiting list for the COVID.
Okay, good. And when was your last mammogram?
About 8 months ago.
Okay, and what were the results for that?
They monitor it every 6 months because I have cyst in my left breast. So I'll be back again next month.
Okay. When was your last CPAP or pap smear?
It was a year ago, and it was normal.
Okay. What does your diet look like in a day?
Not as good as it should be. I do eat plenty of vegetables, not so much fruit. I usually skip breakfast as much as I know I shouldn't. I get takeout for lunch, and usually we cook something at the house for dinner.
Okay. And do you exercise regularly?
Not as much as I should.
Okay. Do you wear your seatbelt?
Yes.
All right. Do you wear sunscreen daily?
I wear sunscreen if I'm going to be outside, but I work inside an office, so I don't normally wear sunscreen during the day.
And do you have any guns in your household?
Yes.
Do you keep those locked up?
Yes.
Do you keep your medications locked up?
No.
Okay, we definitely recommend keeping medications locked up, especially if there are small children around.
Okay.
And what's your weight?
200.
And your height?
5'3".
Okay, good. We'll go ahead and get started with the assessment. The first thing I'm going to do is just get a set of vital signs on you. Okay, I'm just going to start with your blood pressure. You can relax your arm. your blood pressure is a little elevated. It's 140 over 100. Okay, next I'm just going to take your temperature. Alright, so that's normal, it's 98.1. And next I'm just going to get your pulse and your respirations. You can relax your arm. Alright, and your pulse was 72 and respirations were 16. So I'm just going to go ahead and get started on your assessment. I'm going to start with your head. I'm just going to feel your scalp and look at your hair. Have you noticed any like lumps on your head?
No.
Any dry scalp?
No.
Okay. Alright. And next I'm just going to check your vision. Alright, so I'm just going to shine a bright light in your eye. I just want you to look straight ahead at the wall. Okay, good. And now I want you to follow your eyes with my pen light. Good. And do you wear glasses?
I do. I wear readers.
Okay. And can you read the words on this book for me?
How happiness happens.
Okay, good. Okay. Next, I'm just going to take a look at your ears.
Okay.
Do you have any trouble hearing or wear hearing aids?
No.
Okay. And next, I'm just going to test your hearing. And I'm just going to tap this on my leg. It's going to cause a vibration. I'm going to hold it in 2 different positions. One right outside your ear and the other right behind your ear on your skull, okay? And you're going to tell me where you hear it loudest.
When it's closer to my ear.
Okay. And I'm going to do the same thing on the other side.
When it's closer to my ear.
Okay. And I'm going to tap it one more time, and then I'm going to place it on top of your head. I want you to tell me if you hear it loudest in your right ear, left ear, or equally in both.
Equally.
And next, I'm just going to assess your nose. Have you had any runny nose lately? Any allergies?
No.
No, okay. Next, I'm just going to assess your sense of smell. So this is an essential oil. I just want you to tell me what you think it is.
Peppermint?
Yep, that is correct. Okay, now I'm just going to take a look at your mouth. Open wide. Stick your tongue out. Move it side to side. Okay, and have you had any dental work done recently?
No.
Okay. When was your last dental visit?
About 8 months ago.
Okay, you want to make sure you're going to the dentist every 6 months to get those teeth clean.
Okay.
Now I just want you to stick your tongue out again, and I am going to test your gag reflex. Okay, good. Okay, now I'm just going to assess your facial sensation. So close your eyes and tell me when you feel me touch your face.
Feel you touching
All right, which side?
it. Left side.
All right,
Right side. Forehead.
good. And can you raise your eyebrows up for me? Good. Can you smile? Can you puff your cheeks out? Good. Okay. And next, I'm just going to assess your neck. So I'm just going to feel for any irregular lymph nodes that might be swollen. Have you noticed any swollen lymph nodes lately?
No.
Okay, good. Can you swallow for me? Good. And now I'm just going to feel the pulses in your neck. Okay. These are nice and strong. Now I'm just going to go ahead and listen to your lungs. Take a deep breath for me. Deep breath. Deep breath. Deep breath. Deep breath. And deep breath. Good. I'm also just going to assess your spine. That feels normal. You don't have any history of scoliosis?
No.
Good. I'm just going to look at your skin on the back as well. That looks good. Do you have any like irregular moles that you know of?
No.
Okay. And when was the last time you had a breast exam?
About 8 months ago.
And do you do self-breast exams?
Yes.
Okay. Yep, we recommend doing those every month. Have you noticed any dimpling
No.
or lumps?
No, but I do have to go every 6 months because I do have cyst in my left side. So I go again in a couple weeks for my regular mammogram.
Good. Now I'm just going to go ahead and assess your arms. I'm just going to look at your skin to make sure it's normal. Okay. I'm going to look at your hands and your fingernails. Okay, good. And I'm also just going to feel for your pulse. I'm going to feel for your pulse at your elbow as well. Okay, those are nice and strong. I'm going to do the same thing on the other side. I'm just going to look at the skin. Alright, I'm just going to look at your fingernails, test your capillary refill. And again, I'm going to check your pulses. Okay, those are nice and strong. I'm just going to test your strength. Can you squeeze my fingers? Okay, good. Can you raise your arms up? All the way to the side? Good. Alright. And now I'm just going to listen to your heart. Do you have any heart murmurs that you've been diagnosed with?
No.
Have you felt a past heartbeat or any palpitations?
No.
Okay, I'm just going to listen. Okay, good. And now I'm just going to feel for your pulse, okay? Okay, good. And now I'm just going to listen to your abdominal sounds. Can you tell me when your last bowel movement was?
This morning.
Okay, and was it regular?
Mm-hmm.
And you haven't had any constipation or diarrhea recently?
No.
Have you had any gynecological issues recently?
No.
Any abnormal discharge?
No.
Okay, good. I'm just going to listen to your stomach now. Okay, and next I'm just going to tap on your belly a little bit. Okay, good. And now I'm just going to palpate. Just let me know if you feel any pain anywhere. Okay, good. And do you have any like rashes or skin issues?
Mm-mm.
Okay, good. Next, I'm just going to start on your legs. I am going to feel your pulses again. I'm going to start with the ones in your feet. Okay, and I'm just going to feel behind your knee as well. Okay, good. I'm going to do the same on this side. I'm just going to feel the pulse behind your knee. And have you noticed any swelling or edema in your legs?
No.
Okay, and your skin also looks good. Are you able to lift your leg up and bend your knee? Good. Same with the other side. Out and bend your knee. Okay, and I'm just going to have you stand and walk from me to that chair and desk as well. I'm just going to assess your gait. Good. And come on back. Have you noticed any mobility issues?
No.
Okay, good. And next I'm just going to go ahead and test your reflexes. So I'm going to test those in 2 different areas. So I'm going to test your knee first. Ready? Good. Other side. Good. I'm going to do the same with your elbows. Okay, next I want you to close your eyes, and I'm going to place an object in your hands, and you're going to have to guess what that is, okay?
A remote of some sort.
Yeah, it's TV remote, good. Alright, now I want you to close your eyes again, and I'm just going to poke you, and I want you to tell me if it's dull or sharp.
Dull.
Okay.
Dull. Sharp. Sharp. Dull. Dull. Sharp. Sharp.
Okay, and I'm going to do the same thing in your feet, okay?
Sharp. Dull.
Okay.
Dull. Dull. Sharp.
Okay, good. Okay, and do you have any other questions or concerns for me?
No, I'm good.
All right, well that concludes your assessment.
Thank
Thanks for
you.
coming.